All right, we are on. Welcome, everybody, to this week's episode of Weekly Dose with Dr. Uday. We are going to be talking all about back pain and management treatments. We have Dr. Mitchell here with us today, so it's going to be really good. Thank you so much for making it. So, I'll start with introductions and then we'll get right to it. So, for those that don't know me, my name is Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine. I also provide aesthetic services to my patients and clients. And with both modalities, my goal is to have my patients not only feeling good, but looking good. So, Dr. Mitchell, I'm actually going to switch it over to you. I'll let you introduce yourself so you can do it justice, and then we'll get started. So, welcome.
Sure. Well, thank you. Well, my name is Dr. Lucie Mitchell, and I'm board certified physical medicine and rehabilitation physician and interventional spine and pain specialist. So that is a mouthful to say. However, I'm currently in private practice in Rome, Georgia, and I'm also the owner, founder, and CEO of Phoenix Noir Designs, which is an art company that I have where I do a lot of abstract paintings and art that pretty much encompasses, our spines or our pain and putting it into something nice and beautiful, because I know pain can be something that is dragging, it is daunting, but there is beauty in pain. So I like to express that the way I can.
I love it. I love it. So actually, I'm glad you mentioned that. I'm going to ask you a few questions on the side about that, but we'll talk about
Yeah.
pain. So, from your perspective as a specialist, when you hear back pain, what's going through your mind? What's your perspective on that?
You see, I feel like a detective, right? Because when it comes to back pain, usually I get somebody that comes into my office or my clinic and say, hey, I have back pain. And I'm like, yes, okay. Like, tell me more, right? Because when it comes to pain, it can be it could be the bones, right? From arthritis. It could be muscles. There are nerves back there that could be causing some referred pain. So there's all these components to when it comes to back pain. And I like to dig a little bit deeper to see as far as, what could be causing the pain. And then from there, I look at the imaging and try to put the picture together, because sometimes what I see on images doesn't always match the presentation, right? And so there are those aspects that we have to dig a little bit deeper to figure out what the root cause is at times.
So, I mean, there obviously are a lot of reasons and a lot of causes for back pain. You kind of touched on it a little bit. So, I would ask from your perspective, give us like a broad overview of the causes that you think of when someone comes to you with back pain.
Yeah. So back pain could be idiopathic, meaning we don't know, right? But it could also be due to over time as far as wear and tear, right? Because as we are working or just going through our whatever our pathway in life could be, right? You could be somebody who started working when you were 10 years old and now you are 50 years old and you're like, hey, my back is hurting. And then next day, you are riddled with arthritis, right? Because that is one of the common causes of back pain. And then you're saying, how did I get there? It happens over time, right? But another cause could be, it could be from an accident or trauma, right? You could have been sitting at a red light or a stop sign and somebody got you from behind, right? And then you do this, the whole whiplash thing, right?
Right.
That you may not feel it that day, but the next day I guarantee you're gonna feel that,
Sure.
So that's another cause. Other causes are cancer, for example, when it spreads to the spine, that can cause some pain as well. And then there are other causes such as, muscle spasms. All those things can cause pain. And so when somebody says I have back pain, and it's that have degenerative disc disease, right? Because in some cases that can also cause pain, but not in all cases. Is the most common cause for referrals that I get is somebody that has that in their back, right? But here's the thing about that is we all have it at some point in time. It may not be as severe as somebody else's, but we do have that. And then does it always cause pain? It can, but it doesn't always.
Gotcha. Gotcha. So, I mean, obviously, we're talking about back pain. So, that's in itself is a symptom. But what specifically, when people come to you, do they say, hey, my back pain feels like, if you will?
Yeah. Usually they'll say it feels like a sharp pain, as if like, they were walking and then they got hit in the back. They're like, oh, what was that? And sometimes some of them do look back and say, hey, was this somebody that just hit me? But it
Right.
can be like a little punch, that you felt back there. It can be sharp, it can be aching, it could be like a dull, like toothache kind of sensation. And for some people, it could be burning. At time I hear like, I feel like my back is burning from like, across my back and stuff, or it feels a little swollen. And so those are some other common symptoms, or, how it can present in anyone when it comes to pain. And for back pain, it's not just your low back. It could be your mid back. It could be up to your neck. That's all part of your spine.
Yes, absolutely. So what are the thought processes you're thinking when you go through diagnosing a patient, if you will?
Yeah. And so my first thing is I want to know, when did it start, right? Is this something that's acute, so it just happened, or is it chronic, as far as been over 6 months ago, but it's still, being a pain in the butt, literally, right? Then I want to know, how does it feel? Is it sharp, stabbing, shooting? Is it dull, aching? So I want to know those components, because that's going to clue me in as to bone, muscle versus nerve, right? Then I want to know what makes it better, what makes it worse. How would you grade the pain? As far as I hate the scale from 1 to 10 because it's very subjective, or 0 to 10. But what I like to say is, if the pain starts off at 0, and then by midday your pain is like, you got to 100%. It's like, hey, I'm at 50% of like pain right now. I'm halfway gonna lose my mind. I want to know like a percentage from that standpoint. So that's what I like to use when I ask about pain. Then I want to know, as far as when it started, was there a trauma event? Did you fall, or did it just happen? One day you got up and you started feeling that pain and it never went away. And so that's what's going through my mind as we're talking, is because from there I can pretty much map out a pathway as far as where we are going to go with our next steps, as far as what to do, where to go. And from there, you can say, okay, based upon your symptoms and your presentation after our exam, here's what we have or don't have, and here's our plan A through Z.
Okay. And then with diagnosis, do you always use imaging?
Not always, because sometimes you can diagnose something, and then it's like a textbook. For example, somebody has something called radiculopathy, right? That means that the nerves are being pinched somewhere, and then you're feeling the symptoms going down your leg or down the arm or whatever the case is. And there's certain exams that we can do to provoke those symptoms, right? And once I see that, I can, confirm it as a clinician. However, now we get into like their insurance companies, right? Because if I say, hey, you got this going on, but here's how we can, a way to manage it, right? Then it's like, okay, great. But for me to go to that far, we need to have these check boxes marked.
Objective. I was waiting for you to say that.
And then it's like, hey, can we or can we not? I know what we should do, but can we?
That is true. All right. So then the big one is the treatment. What modalities and overview wise do you have for treatment for this?
Yeah. And so I like to come up with like the big 5, right? So these are big umbrellas. So the first is, some people do nothing, which sucks, but some people do nothing. So that is an option, right? It's not a great option, but it is an option. There's also the most conservative options, which would be physical therapy. There's also acupuncture, there's massage therapy. And so those are the home exercise programs. And so those are your most conservative. So that's number 2. Number 3 would be medication, whether it's over the counter, prescription, topical. So anything from Tylenol to, Aleve ibuprofen, to anything from like, oh, I'm using like a lidocaine patch, a lidoderm patch, or I'm using a TENS unit. So any of those things, can count as something, or somebody may be on something a little bit stronger, right? But again, that's part of the big umbrella as far as medicine. The 4th option would be injections. Again, that's a big umbrella, right? And other injections for fall trigger point injections, there's different types of epidurals. There's also meter branch blocks, which is when we quote unquote burn the nerves, right? And so all these things kind of fall into the injection category. And then the 5th thing, which is what a lot of people try to avoid, which is surgery. In some cases, it is needed, like yesterday, and in some cases, potentially in the future. But if you can hold out and these other things help, we can go that route.
Gotcha. This is so helpful. So what if we have a listener that is having back pain, or they've already seen a specialist, or, this is something that is affecting, their everyday life, what actionable tips would you give them to move forward with?
Yeah. So if you have tried everything from, injections, medications to different kinds of therapy modalities, TENS units, stimulators, epidurals, and all those things, and still nothing has helped, and you are not a candidate for surgery, then other options, outside of all those things are things that people, forget about, such as even speaking with a mental health provider and speaking with a psychiatrist. Why? Because pain is a cycle, right? It affects you physically, mentally, spiritually, emotionally. So it affects a lot of things, right? And because of that, you need somebody on the team to also help unpack all those emotions, right? Unpack all the pain that you're going through because it's affecting your day to day. And so something like CBT or finding other means to help distract you from pain, whether it's going to be painting, journaling, whether you go axe throwing or whatever the case is, but something outside of your normal, but something that you would enjoy doing, that's legal also. To help, with the pain as far as controlling it, right? Because there are going to be certain pains that we cannot take away because we can't take away your arthritis, right? But we can try to help change the mindset, right? Because if you have a baseball game to go to and then you are dreading it because you're saying, well, I have to walk up all these stairs, then I have to find a parking, then I have to walk on gravel, then I have to go up the bleachers, then I have to sit on the hard bleachers, you're already psyching yourself out from going to the game, right? Because now the game's not going to be enjoyable. It is done. You're going to go there, complain, get home, you hurt some more. And so it's finding ways to change the mindset, right? So that way you can actually enjoy the game and not ruin it before you even get there. And so because all these things are things that we see daily as far as like, oh, I hurt so much so I can't do anything, but now I'm gaining weight, but I have to exercise, but I can't. So it's a cycle, right? It's a very negative cycle, and the mindset has to get changed, and it doesn't happen overnight. And so that's why seeking additional help, like psychiatry or mental health, can help as far as being a good addition to the team to help break those cycles.
Absolutely. That is really, really, really important. Very interesting. Okay. So on the flip side, just a little bit about you. I always ask, why do you do what you do? So I pose that question to you. Why do you do what you do, Doc?
I love a good mystery. Even I remember when I was in med school and even residency, where pain would come in, back pain would come in, and all the residents would say, "Oh, another back pain." I'm like, "Yes, this is great. What you mean another back pain, right?" Because it's I guess it's because people can fake it easy, right? But there's some things you just can't fake. It's some things you just can't not unsee as far as what is on your images or clinical presentations and stuff, right? But the same as somebody can fake anything, right? But people do need help. It is one of the number one causes of disability in the United States, and it affects a lot of people, right? You don't have to be 85 to have back pain. You can be 25 with back pain, right? But my whole thing is to help restore, function and to increase quality of life, right? I don't have a magic wand. I can't even say, hey, I'm going to take it away because I can't do that. But what I can do is help decrease it and get it under better control. And that's the thing that I enjoy doing. And I enjoy figuring out, why you're hurting, where it's coming from, and what can you do about it. So that's always what I like to end up trying to figure out.
That's amazing. I mean, it's just well needed work. So I was telling you, in our area, we definitely need your specialty. I guess the other question is, and it's it's a curveball. It's with all the experience that you've had, all the life that you've lived so far. If you got a chance to meet your 20-year-old self, what would you tell them? What would you advise them?
I would advise to, one, not judge by cover, because there's a lot of things as far as when I was 20 now I see people in pain. I'm like, oh, they're probably faking or something, whatever, right? But then as I get older, I'm like, oh, I bite my tongue a lot because I'm like, that'd been me, like, talking crap all these years ago about somebody and not even knowing their backstory, right? And then not just that, but just know that to, always show sympathy, empathy, because you just never know what somebody's going through, because you don't know how hard somebody has been trying to, whether it's lose the weight or do whatever to help with their pain. and
Right.
seeing their situation. And then now it becomes a full picture like, wow, I was saying to do all these things, but they really can't, or they've tried and they're still trying, but it's just life deals people with certain cars that they try to get out, but they just can't, not because they don't want to, but because they just literally can't not, you know?
Absolutely.
And seeing that more now with, you know, a lot of patients and just people in general, I would be more empathetic back then than I probably was.
That is a great answer. I always ask that because you just never know who you would help out there with that question and answer. Um, Before we wrap up, I think the other thing you'd mentioned designs. So, and you're an artist. So, if you could just kind of give us a little bit of how you got started on that, and why you do that, and all that.
And so I've been creating art since middle school, right? But I didn't find my niche, I think, until probably when I was in fellowship, right? Because when I love me some spines, right? And when I'm sleeping, even when I'm painting, subconsciously a spine comes out in the design somewhere. I'm like, I didn't mean to do that, but it's always on my mind apparently. But I have, I don't have low back pain, but I do have my leg that gets completely numb at times, and it's like, oh, but I do get neck pain, and we, as a people, as a human, we have pain, right? It's not just always physical pain. It could be, stress from whatever, or feeling burned out, whatever the case is. And then when COVID happened, things really took a turn. And so that was my chance to try to find a way for me to, escape that reality that was going on. And I found me painting more, and that definitely helped alleviate a lot of stress, a lot of pain, a lot of things. And so for me, being able to create beauty out of pain, was something that I continue to do because it helps me and helps me help somebody else. Because I can't help you if I'm not my best self. And so
That's
for me
right.
to do that, I got to make sure that I'm in the right space, right headspace. I feel good.
Agree with
And that
you.
way I can better help you get to that point.
Absolutely. I always say you can't give somebody what you don't have.
Yeah, exactly.
So that's true. So that's beautiful. Thank you so much, Dr. Mitchell. So anybody that is looking to connect with you, or get in contact with you, or check out what you do, how would you suggest they do that?
Yeah. So on Facebook, I'm under Lucie Mitchell, Lucie, and then Mitchell, Mitchell. However, on Facebook and other social media platforms, it's under my art. So it's Phoenix, like the bird Phoenix Noir, Noir Designs. And my website is also phoenixnoirdesigns.com. Instagram, TikTok, Facebook, the whole shebang. And on YouTube, you can watch me paint just for relaxation. And that's under Scrubs and Arts. That way scrubs every day. And I'm doing some
Okay.
kind of art daily also.
I love it. Oh, that's awesome. Okay, I didn't know you painted live. Okay, check it out.
Oh,
All
yeah.
right, well, Dr. Mitchell, thank you. Thank you. This was so good. And for those of you out there, definitely check her out. I'm sorry, what did you say?
It's my pleasure.
Yay. Yay. So definitely check her out. On the flip side, if you're looking for a primary care doctor, we are at Apple Valley Family Medicine. We are accepting new patients, and we would love to help. Our number is 304-350-1087. And you can catch us online at www.applevalleyfamilymed.com. So that's the end of it, guys. Thank you, Dr. Mitchell, and everybody have a good week. Bye.
Yeah.